I'm Amanda Silliker for Canadian HR Reporter TV. Tom Beegan is the Chief Prevention Officer for Workplace Safety Insurance Board Ontario. He spoke with us at the Partners in Prevention Conference about reducing the number of deaths, illnesses, and workplace injuries in Ontario. How do you go down the road to zero and try to have no injuries?
Well, the road to zero is an interesting journey and a destination we believe everybody should be trying to achieve and reach because there is no acceptable level of injury, illness or fatality in a workplace. Particularly in a sophisticated environment and society like Ontario, we expect the best and we should have the best. And we have available to workers and employers all the tools, all the advice they need. What we need is people to make the commitment and the pledge that in each workplace there shall be no injuries, illnesses or fatalities. So we're encouraging all employers to join us. There are no shortcuts. It requires a sophisticated management system in whatever side of business you have. So whether you're a micro-employer or a multinational employer, we have ways in which we can help you be that employer of choice, because I think employers know that there is a war for talent. There is a war for people who are the best, who are the A performers. And the only way you can attract those and retain them is to provide a safe, healthy and engaging workplace. Following health and safety practice and management will get you that. That is what's required in this changing world of work.
And what are the steps employers should take to reduce the number of injuries in the workplace?
So some of the simple steps that an employer must take, in my view, is first of all, engage your staff in the process, in a process that you as the owner clearly articulate that it is your desire that there will be no injuries, illnesses or fatalities in that workplace, that you believe and you are committed and you're going to do all it takes to make sure that workplace is safe. That's number one. Engage staff in the process as how best we might do that in this workplace. Make sure all staff are properly orientated and trained, and that there is actual good supervisory management to make sure that happens. Taking those simple steps and measuring how you're doing and rewarding, not necessarily with financial rewards, but acknowledgement. Acknowledgement of good performance, safe performance, and going that extra yard and bring some innovation to the workplace because that's what's required. You can do high quality work and you can do it safer.
What are the most prevalent injuries?
So the most prevalent injury right now is what we refer to as musculoskeletal disorder, or to the layperson, strains and sprains. The thing you got to watch out most of all is your lower back. That is the biggest reason why people are out of work for an injury. Strains and sprains, lower back, neck and shoulder. Watch those. Watch slips, trips and falls. People think about falls, that it's something falling from 30 meters. Not necessarily so. A lot of people slip and trip on the flat. They need to pay attention. They need to have good housekeeping, pick up leads, carpets, mats that can trip people up. So falls is another one. Contact with machinery is the third one. And unfortunately, motor vehicle incidents. The most dangerous thing you can ask a member of staff to do is to drive. Because when incidents happen when you drive, it's usually very catastrophic. The first thing that employers must do is to clearly state their commitment that they will not tolerate, nor do they ask their staff or their subcontractors to do unsafe work. If it's unsafe, don't do it. That's the number one. Number two, make staff are properly orientated and trained to do the job they're asked to do and supervise appropriately. That will go a long way towards having a safe workplace.